My name is Michael Bartis. I'm both an optometrist and an ophthalmologist, having had the good fortune to be trained in both disciplines. And I'd like to talk a little bit about adult strabismus and its place in the primary care optometric setting. I'd like to talk about how gaining a greater understanding and appreciation of adult strabismus, becoming involved in the initial diagnosis and long-term care of patients with strabismus, and making timely referrals for strabismus surgery when appropriate not only improves and expands the quality of care, but also can make sense from a practice management standpoint. Now, when I look at things like this, I like to think of it very simplistically in terms of who, what, when, where, why, and how. Who, of course, are your patients, your adult patients with strabismus, be it long-standing strabismus or new onset. What, of course, is the eye misalignment, whether it's a horizontal misalignment, a vertical misalignment, or a torsional misalignment. Many patients will have diplopia, many will not. Many patients will have asthenopia symptoms, many will not. And some patients will develop an abnormal posture to compensate for their eye misalignment to maintain binocularity, be that a face turn, a head tilt, or a chin elevation or depression, or a combination of the above. When and where should this evaluation occur? Well, I think that it's appropriate to address this in your initial examination with the patient or in any subsequent evaluations with the patient in your office. How? What needs to be done in the evaluation of these patients? Well, I believe that it should be started initially with a comprehensive eye examination and a refraction. I recommend a dry subjective refraction as well as a cycloplegic refraction. This is critical and important information to maintain and provide should a referral need to be made. The next component of the evaluation is the sensory motor examination, which involves an assessment of eye motility, cover testing at more than one position of gaze, as well as at least one sensory examination to establish the presence or absence of binocular fusion. The next component is external photography. Taking pictures in the cardinal positions of gaze allows not only an opportunity to follow eye alignment changes over time, but also to demonstrate to the patient eye misalignment that might not be present in primary gaze and they would not otherwise be able to see, for example, when they were looking in the mirror. The next test that can be done, and is often very useful, is a binocular visual field. This can be done with a Goldman visual field tester using the 3-4E target, or even with a tangent screen to establish how wide a binocular visual field is present and what the effect of neutralizing the objective angle of strabismus has upon expanding that binocular visual field. Optometrists see the majority of adults for their primary eye care in this country, and as a result are in the best position to have the most profound effect on patients with this condition.
My name is Dr. Jeff Wood. I'm a practicing optometrist in Texas, and I'd like to summarize a few things for you that we would like for you to take home from this lecture. Adult strabismus can be caused by trauma, neurological factors, Graves' disease, divergence insufficiency, especially in elderly women who complain of diplopia when driving but not when reading, previous eye surgery, either glaucoma surgery, cataract surgery, or retinal detachment surgery, and previous eye muscle surgery. And in the eye muscle surgery, there may be a 20% recurrence rate over the years and decades that follow the eye muscle surgery. And finally, age and time may cause a change in muscle elasticity and fusional control. Code 92060 is an add-on sensory motor exam. You will need to document that you have ordered this for your patient. Please review the details that were previously mentioned that are required for this exam. Most insurance companies allow a separate charge for this. This exam may also be appropriate in the years to come when following the patients for recurrence. Find someone that you can work with that is good. For more detailed information with extensive references, read The Efficacy of Strabismus Surgery in Adults, a review for primary care physicians by Dr. Bert J. Kushner in the Postgraduate Medical Journal. Thank you for listening. I think you'll find this information to be very helpful in your practice.